See, it's stuff like this that gives me trust issues.
Welcome to the Trust Issues podcast. We have trust issues with the traditional society-dictated path, with the status quo, with the whole get an education, land a job, and work tirelessly until you're 6 feet under. It's time to upgrade your life with the help of us. I'm Erica.
And I'm Kyle Auckland. We're a husband and wife duo, but we're also entrepreneurs, biohackers, and business builders.
Every week, we're dedicated to having purposeful conversations with each other and leading experts on topics like wellness, relationships, and entrepreneurship.
Subscribe to Trust Issues Podcast if you're looking for bold topics, honest dialogue, and valuable lessons.
Welcome back to another episode of the Trust Issues Podcast. I'm Erica.
And I'm Kyle.
And as parents, we are extremely passionate about children's health, being parents to a little 18-month-old, and we're constantly trying to educate ourselves around just different ways that we can be the healthiest family, we can raise the healthiest child. And in our journey of becoming first-time parents, we actually found Dr. Jennifer Rousseau here in Nashville, Tennessee. She's here on the podcast today, and we're so excited to introduce you to her because she was so pivotal in our journey with our son. He was dealing with some breastfeeding issues, feeding issues, some tension in his body, some colic, and truly the things that we learned, not only the things that we gained, but the things that we learned on this journey were just so monumental. And I feel like every parent should know this stuff. Yes. I feel like every parent deserves to know more information about how to help their child be as healthy as possible. And that's why we're so excited to bring Dr. Jennifer Rousseau on for this conversation around children's health. So in this conversation, we've loved listening to Dr. Rousseau's insights, and we know that all the parents listening will be mind blown to hear about what she has to say around craniosacral work, breastfeeding struggles, tongue ties, and so much more. So without further ado, thank you for being on the show today. Welcome.
Thank you for having me, guys. I'm so excited to be here.
We're so excited to have you. We need you to give a little backstory on who you are, what you do for our listeners, and why you're so passionate about the work you do too.
Love it. So I am a board certified chiropractor. I've been practicing for over 15 years, and one of the things that I'm super passionate about and excited is working on chiropractic with kids. I feel like when you can start earlier in life, it gives you a better start to overcoming those hurdles that exist when you hit milestones. So removing the impedances, the imbalances, the things that you see with kids so that they don't have as many issues later down the road. So I feel like setting them up for success earlier on in life just really makes a difference in developmental stages that they go through. So I'm very passionate about kids. We do cranial techniques, adjusting. It's really more kind of focusing on body work so that you can remove those interferences in the nervous system so they can function the way that they're supposed to.
So good. And you have this Instagram page, Kyd Kyro. We will link it in the show notes. And if you are a parent, you need to watch because you will share such good content and tidbits.
Oh, thank you.
If your kid is constipated, stuff you can do at home, and it's beyond just bicycle legs. There's so much good stuff that you have on there. And I think that's part of our story, as we were talking about before we hit record, is, our son, we had a beautiful home birth, and it was an amazing experience. But then we found ourselves having to go to the NICU for just routine jaundice when he was a few days old. And then it ended up, he was put on some antibiotics. So there's some gut stuff that came up. And it was just kind of like a cascade of post-birth interventions that happened.
It's like a domino effect.
That really impacted our journey, and that's where we found you. So I would love to just dive right in. And I think let's talk about the topic around colic, because there's so much confusion around this. And I want you to just kind of break down what actually is colic, what can parents do about it, what can mamas do to help their babies who are experiencing colic. I know we had a super colicky baby for a bit there. So talk about it.
So the definition of colic is uncontrolled or inconsolable fussiness that goes on for prolonged periods of time. There's no true definitive diagnosis for it per se. It's just a fussy baby, basically. But what you have to get to the root of is what's causing the fussiness. Why is it inconsolable? Most babies can be soothed in a matter of different ways. And when those soothing techniques don't work, you have to figure out why. What is the bigger issue and what's the underlying problem? So the ones we look at is it something diet? Is it a protein allergy? Is it, inability to latch? Is there something going on that's causing the fussiness? Are they hungry and they're not getting enough food with each feeding? So what we do is we deep dive into, where is this fussiness coming from? Is it, babies have 3 main functions. I always tell people they have to eat, sleep, and poop. If they can't do one or all 3, then you're most likely going to wind up with colic. Now, there could be other underlying issues that could cause it. That's not the only 3 that are out there, but those are the main functions that they serve. So when you can't do one or all 3, then you have to deep dive and figure out what it is. And it could be anything from, tension in the body. It could be oral ties, which I know we're going to dissect into a little bit, that could cause feeding issues and delay. So really, you have to look at what's causing the dysfunction to get to what is really the bigger problem to the fussiness.
Mm-hmm.
Wow.
So good. And it's like, that's where I think we found you, and we were able to identify, there was some digestive stuff going on.
Yeah.
And he had oral ties. And so it was a multitude of things. You remember. So talk to us about, obviously we are clients who came in to see you, and we're going to get into all the good stuff too, but I kind of want to break it down on how you work with your clients. Cause I think that number one, there's 2 different groups of people who are going to be listening to this episode. Number one is going to be people who can come and access your services and can get on your waiting list and work with you in Nashville, and they're going to call your office and book an appointment. The other group of people who are not local and they want to find someone who does what you do, break down what you do and how you help children in your practice.
Yeah. So what we do is we start with a consultation. We go through and we kind of explain everything that we're going to do in that visit, down to an in-depth neuro exam, an in-depth look at to oral function. How are they feeding? Is there dysfunction? What tensions are in the body that need to be corrected, for lack of a better word, or addressed. And so once we look at that, then we kind of we can try the treatment plan that would be our goals for care. So what are our goals? Is there inability to feed? Are we not sleeping? Are we constipated? Are we reflux? Are we colic? We look and see what every patient is different, and everybody comes in at a different stage. What a newborn is going through is very different than what, a 4 or 5 month would go. And you have to look at what are the regressions that their child's going through too. So we look at kind of what stage they're in, because babies change so much in just a matter of weeks to months. They go through so many progressive leaps and phases and growth spurts. So we look to see, where's that child? What do they need? Can we fix it? And how are we going to fix it? And once we get through that, then we can go through phases of treatment and figure out what do we need and what are our goals of care? What are the goals for that child? What does that patient need? And how do we get there? How do we get you from colicky, not feeding, not thriving, to thriving, to being happy? And, telling parents, I say, when we start this, it's a journey, it's a process, and it's not an easy one. It's a lot of tears, but it's worth it when once you get through this process, you have a completely different baby.
Mm-hmm. And we did.
So it's something that you did. Yeah, you did. And I tell parents day one, I'm like, this is going to be a lot. And it's not that it's hard, it's just not knowing. And that's, you mentioned that's the reason we started that Instagram page. I get this a lot, and it's, to put yourself out there in such a profound way is not easy. And it is not for the weak, but
right.
Yes,
it's hard out there. But the reason we started this is because when you have a baby, nobody really tells you what to do. Yeah. And that was my struggle they really don't. No one really, there's books and there's literature, but there's no one really to tell you all the tips and tricks and the nitty gritty. What does that 4-month regression look like? What does teething look like? What does it look like when sleep patterns? What is, I had somebody say, my so-and-so recommended tummy time, but they didn't show me how. How do I do tummy time? Do tummy time? Well, my kid hates tummy time. So what do? I make him sit there and cry? It's like adding to the colic. So what do I do? Yeah. And so it's, let's show you, let's figure out why do they hate tummy time? Let's dive into what is it that they don't like about it? How do we improve it? And then how do we make it better? So here's how you do tummy time. Here's how you can make it where they enjoy it. And so that's, part of the process is not just treating the symptoms, but also figuring out how can we create an environment where you can thrive, and how are here's tips and tricks. So the reason we created that page was to give parents some insight and hope on kind of what to do, is because as a parent of a newborn baby, it's terrifying when no one tells you what to do. It doesn't, like, they don't come with like a manual, like when you buy a car or, you know, a car seat, and it's like, here's the instructions, and you're like, I got a baby, what do I do? And people are just like, I don't know what to do. So that's kind of why we started, was to give parents step by step, like, here's some tips and tricks if you've got constipation or gas or colic, or, you know, here's some things that can adjunctively help you through this process. So that's why we started that page, was to give parents some hope of like, why don't we help you guys? Because as a twin mom, I went through these struggles, and they're very real. And it's hard when you don't know what to do and you're just kind of winging it. And so if I felt like most parents feel like if someone could tell you what to do, it would take a lot of the stress and anxiety of the process out. And making it where you can enjoy your baby. I want you to enjoy this process, because when you stress all the way through it, it takes that joy from it, and you can't get that time back.
So literally, it kind of circling back to that beginning of like everything you took us through with our boy, it was like, okay, you're going to do this now. It's going to be uncomfortable, but I'm going to tell you it's going to pay off so much in the next couple of months. And every single time we came in to see you and you kind of gave us this little roadmap of like, hey, you do X, Y, Z, it's going to help here. It absolutely helped. So like literally, I think you were really the first person that we dealt with that like truly gave us a roadmap, and like it worked. So like it was very special to work with you and continue to work with you. Yeah.
Oh, and that's why, and I'm so thrilled to hear that. And that's why I do what I do. You know, it's not an easy job by any means, but I'm so passionate about creating this safe space of parenting where parents can come together and feel like they can get information that is useful, helpful, and in a positive, endearing way. You know, it breaks my heart when people go to a provider and there's no hope. They're just like, just, you know, suck it up. Yeah. Or change the formula. Like, here's meds. Like it's and sometimes those things are needed. Absolutely, they're medically necessary. But it always breaks my heart when you go and, you know, there's no answers or no hope. And so that's, you know, for me, every parent, I want you to feel like there are tools that you can use to help guide you through this parenting process with a newborn and with a baby, through these stages, to take that anxiety and fear of not knowing away, to help guide you through this.
Yeah, and one of the biggest modalities that you use and teach, or you taught us as we were, you know, our son was in treatment with you, is craniosacral work. Yeah. So can you talk about what that is? What is craniosacral? Why do children benefit from it so much?
It's a great question. So craniosacral is using its body work to release some soft tissue interferences that are in the body. So we use it for kids with, most commonly you'll see torticollis and plagiocephaly, which is a flat head. Oftentimes it's due to tension in the mouth, the neck, and the body, or from birth trauma that causes interferences where they can't fully get that range of motion. So they favor one side and they get a flat head. So we use craniosacral techniques to help round the head out, help cranial reshape, and then also to body work, oral tension. You know, when they've got oral ties, cause tension in tissue inside and outside of the mouth. You've got muscles called pterygoid, zygomatic, maxillary sutures that really get tight when those oral ties exist, where they can't suck properly. So they wind up with a shallow, chompy latch. So what we try to do is release the tissue around that using cranial methods to help loosen it up so that they can function the way that they're supposed to. So that's one of the many reasons we use, is mainly body work for body tension so that they can just feel better.
Mm-hmm. Amazing. Let's talk about oral ties, because it's such a topic. It's such a good lead-in. You know, our son, I wanted to... Here's the deal. I think there's two different camps on oral ties. I know you know this. There's the one camp of you can do all the body work and you don't have to get the release. Yeah. And then there's the other camp, I feel like, is no, get the release immediately and then deal with the body work afterwards. And I'm not finding a lot of in between of maybe it's both and. And I was resisting it so much, where I was like, I don't want to put my child through this procedure. I don't want to have his oral ties lasered. But I can say that the day that we got his oral ties lasered, which it took us about 3 months to do it, finally we got an appointment. We got assessed. He had a severe tongue tie, lip tie, and they just grazed his buccal ties. So his cheek ties, buccal. And it was like instantaneously, he was a different baby.
Yeah.
I mean, it was crazy. And we were doing the body work. So I would love for you to talk about like, okay, what are oral ties? Are they a thing? Are they a thing that people can benefit getting released? Can you get released and not do, give us the whole lowdown on them.
Got it. Okay. So great question. And I do get this quite a bit. So the big one is like, do we have ties? What do they mean? And do we have to correct them? And the answers are every child is different. Some kids may have, so what oral ties are, it's a band of tissue that exists on a frenulum. So they exist in top, upper lip. They can exist under the tongue. You can get buccal or buccal, depending on how you look at them. You can get them in different parts of the anatomy of the tissue. And they're related to midline congenital defects. What they cause is potentially interferences in feeding. So it creates this kind of clamp where there's tension in the jaw where they can't quite feed as efficiently as they could or should. The things that oral ties left if uncorrected later can cause issues with airway, with breathing. And all of this information is out there. This is not, I didn't make this up. This is in literature. This is in reviews. This is out there. Pediatric dentists will tell you the same thing. Is airway, potentially speech, feeding. They'll picky eaters because they're always protective of that, but also too, you'll see high palates, and that high palate is where you get that gag reflex in conjunction with that. So when we look to see, we work with lactation and other pediatric dentists and other oral tie specialists for definitive diagnostics. So what we look to see is oral tension, and then we'll refer for co-treatment. So when we refer, we say, okay, do you see these things? What are the ties? They grade them. We personally work with different dentists and lactation experts that can definitively diagnose these things and say yes or no. And then the other question we get is, what are the ties? And then we get, do we have to get it revised? Do we have to treat it? And it depends on the child. There's no yes or no. Every kid is different. Some kids may have them and maybe they're not as severe, or maybe they don't have all the combination of ties. Maybe they have top lip and buccal or cheek ties, or maybe they don't have a tongue tie. So it really comes down to what is the function of the tongue. The tongue is really what has to be able to function in the mouth for chewing, sucking, feeding, those kinds of things. So depends on the child. Some kids, we can do conservative body work for a while and that's enough. Or in some parents, it's severe and it needs to be corrected. It depends on the child. There's no right or wrong. There's just variations based on the patient. It's based on what does that patient need. Because I get asked, does every kid need a revision? And the answer is no. Not every kid needs it. Some do, some don't. It kind of depends. What we'll do is do conservative, body work too, to see if we can loosen the tissue. And if that helps, great. Their goals are met. And it goes back to, what are your goals? Yeah. So are your goals X, Y, Z? And then are we meeting those goals? If not, then we do this. And I often tell people, you don't have to pick. It doesn't have to be this or this. It can be this and this. Because sometimes you have to do body work and a revision, or body work, revision, and feeding therapy, because they need to learn how to reuse those muscles to feed. Yeah. So every parent, I try to tell people, don't get locked into a box of A or B. Sometimes it's A plus B plus C equal D. So it's okay to have an amalgamation of things. Sometimes that's what you need to get to where you need to be.
Well, I was going to say, and that's where it was so refreshing to work with you, because we did bounce around a little bit, and it was like, you have to do this. And we were like, well, do we have to go down that road? And then another person would be like, no, you got to do this first. And it was like, oh my God.
A lot of absolutes.
Like, it was like, what do we do? And you were the first one who was like, well, let's really assess and then take everything into consideration. And it was like, wow.
Yeah.
It's like
kind of like brought a team together for it.
Yeah.
Why? So we had a child that had a tongue tied, several tongue ties. Will our next child have tongue ties? Is that, so why are tongue ties forming and developing? I think parents want to know if they're having, I hear from mamas, like, I could never breastfeed because there was always issues breastfeeding. And that's a whole nother conversation I know we're going to get into, but just because our one child had tongue ties, will our next child have tongue ties? How does that work?
Not necessarily. It depends on genetics. The genetics are a big part of this. So everybody's different. What causes the ties, there's no real true definitive answer. Definitely seeing an influx, but I think part of it is there's better diagnostics. There are better tools to diagnose and now treat these ties. So is it that they were always there and there were not the metrics to find them? There weren't the metrics to diagnose and treat. And that's, I think, a big part of what we're seeing now is as we evolve and change, you must also evolve and change in how you treat. And so looking to see what are treatments, what are diagnostic measures, we're able to find them, assess, diagnose, and treat better. So that's, I think, a big part of why it's become, there's more information. There's also more literature, research, and information. There's more people asking questions like, do we have it? How do we assess it? What is it causing? So I think the accessibility of information and the ability to assess what it is, diagnose and treat is also more profound than it was, 5-10 years ago. So I think that's a big part of it too. And, just because one child has it doesn't mean necessarily the next one. It depends, everybody's different.
Yeah, wild. I know I have tongue ties, so I'm like, I gave him to my child. That's my genetic expression.
That's what I was going to say. It's like now our boy is starting off when, he's eventually our age. He's going to have all these things taken care of, where I feel like just recently we've kind of discovered some of our own issues, kind of tying back to possibly our own ties.
Kyle mouth tapes.
Yeah,
and,
I use mouth tape.
And puts his nose strip on at night so that he doesn't mouth breathe.
Yeah.
Mouth breathe,
and I've had TMJ issues for a long time, and I'm getting some treatment for it, but it's a long journey. That's really freaking hard as an adult to have to go through that.
And it's exactly how we started the conversation, where you said it's so beneficial to get these done right away and do some of these issues up front than to go years and years and then have to go back, and undo everything.
Right.
I know you've shared some stories with us, and obviously there's confidentiality, but what do you see in terms of difference between the newborns that you treat and then the toddlers or the 6-year-olds, who are coming in and their parents are just figuring out, oh, wow, like I think our child has a tongue tie, or he's got,
Yeah. So one of the things we see, and I see this commonly in older kids that haven't had it, have any kind of diagnostics, or maybe they just didn't know, it wasn't brought up by a provider, or they didn't have the resources, depends on what region you live in. But what I will see most commonly is when they get a little bit older and it hasn't been treated properly, if they have it, is developmental delays. Say maybe like we didn't do tummy time, or we didn't crawl, or we didn't roll, or maybe their speech, speech is not quite right, or feeding. We're really picky eater. There's only a few things we eat. We're not growing. We're not gaining. In some cases, it could be failure to thrive because they're so picky. It's different things. It could be sleep. It could maybe there's behavioral issues because they're not quite sleeping right. So the airway, they'll wake up. So they're always tired, but they're always wild. And so things we see is sleep issues, breathing, behavior, feeding, speech. Those are some things we see kind of later in life. And it's kind of, it depends on the provider that does it, versus laser versus cut. That's a whole nother thing. But if the sooner you deal with these things, the less of an issue it becomes later down the road.
Mm-hmm. Yeah. What are some essential milestones that parents of, let's say newborns, because we are first-time parents, and we learn, we're like our second kid, we're going to be like, call 1-800-JEN. Like, we're going to just like have everyone on speed dial. We have the feeding therapist, obviously if we need all those things, but
you need
I think, it's like we have our team. We have our whole team now.
That's your team. I love it. You're prepared.
We are prepared. And the first time around, we were not prepared. So maybe, can you speak to a mama who's about to be a first-time mom, because I think it's overwhelming. Gosh, like I did so much preparation, and I'll just speak to my experience. I think I did so much preparation for the birth and and I was like so focused in the journey of pregnancy. And I honestly was really naive around breastfeeding. I thought breastfeeding was going to just be, put my baby on my boob and it's all going to be good. And that was not our experience. So what are some key things mamas can look for when it comes to their newborn baby? Now they've got this fresh little babe out the oven. What are some things that they can look for that would be considered, I guess we won't say abnormal, but things to just like, oh, maybe that's a little bit of a flag to go and get support?
Yeah. I think one of the best things you do if you're a new mom and you're not really sure is access resources like lactation. I'm a huge fan of lactation. I think getting someone in there who can kind of say, here's some tips. Like here's, because the assumption is they just go on and feed. And so people assume like, well, you know what to do. And I'm like, no, not necessarily. Babies, you have to coach, you have to train them, you have to help them along. There's literally the expression, you have to baby them. And you have to guide them. You know, not all kids, some kids can come on and nurse and they're great. And some kids can have the ties and nurse just fine. I've seen that too, because they'll adapt. They know they have to feed, so they'll just figure it out. They'll just nurse away and they gain and they're fine. They don't really have any issues that present when they're babies. So I think starting with lactation, starting with your provider, getting an assessment, say, hey, what's XYZ? What do we need to be set up for success? And then where do we go from there? You know, that's kind of one of the reasons we started this page with social media, is to give parents these tips. Like if you got a colicky baby, look for XYZ. So we give a lot of tips and tricks, and we're in the process of also, which we're really excited about, is creating a series of online courses for new parents. So we're going to try to put some we're really, this is the next step.
That is
we're trying
awesome.
to put,
yeah,
we're excited. Coming soon. But is putting together online courses, step by step, of what to expect. Like first few months, first few weeks. You know, what is 4-month regression? What is 8-week growth spurt? What do these things mean? So creating some step-by-step courses, a guidebook for parents in what to expect after, like what happens next. So pregnancy is kind of the prequel. So you're pregnant, that's the forward, that's the prequel. Then you have the baby. That's chapter 1.
Yeah.
Pregnancy is the prequel. Because when you're pregnant, you know, I see this a lot with our patients. When we're pregnant, we're so focused on like getting to labor delivery. Like, let's make sure that everything's set up, we get to labor. And then I'm like, then we have a whole bunch of other stuff to talk about once the baby comes out. We need to assess, you know, function. We need to assess all kinds of stuff. So when you have a baby, if you start doing, and there's so much information out there, you know, thanks to the internet, social media, you know, that's kind of the fastest way people gain information is really social. They go online and they ask their moms. They go to a group, they go on a page, they hashtag it, they search it. And I always tell people with information, especially Google, there is an abundance of information, but a lack of wisdom.
Yes.
So when you seek information, make sure you get it from a credible source.
Yes.
Can't emphasize that enough. So research the right information. And then ask questions. Just always ask questions.
Even, you know, there was things that she taught us when we had, exactly. Pregnancy is the prequel, and then chapter 1 hit. And there was things that you taught us that honestly had set us up for success. Like you said, the growth spurts. Yeah. And what are the growth spurts going to be like? Is your baby extra fussy around those times? Oh, they're probably going through a growth spurt. You also told us about the leaps, you know, developmental leaps, and to look for those. And they were,
spot on.
I mean, I had that app. I downloaded the Wonder Weeks app, and it was spot on. And it was every single time we were like, something. Oh, it was a leap, or we're at that benchmark of a growth spurt. And I think that's something that also just helps with expectations. Because I think that in our society, we have a lot of, do you have a good baby? Do you have a good baby? Right. Does your baby sleep through the night? Does your baby? Right. And no, we did not have that like societal standard.
With a wide brushstroke.
Yeah, but I think it was like, but the expectation helped us be like, it's not that he's a bad baby. It's not that there's this good baby. It's he's growing. Yeah. And he's growing, and he's going through these things that he's a new little babe on this planet, you know, it's all new. So that was really helpful for us.
Yeah. And it's like you said, you know, there's kind of myths, you know, there's myths and there's truths. And, you know, one is like, do you have a good baby or a bad baby? Well, in order to determine what a good baby is, what is the metric for that? Yeah. What is the metric for a good or a bad baby? You know, and the assumptions are, you know, for us, it's do we eat, sleep, poop? You know, what's the algorithm? What's the algorithm to creating a healthy, happy baby? And so knowing those things, and it's the expectation is you have to help them thrive. You know, some kids come out and they're fine on their own. They eat, sleep, poop, and they're good. They don't need any help. But some kids need help, and that's okay. It's okay to access those resources to get them where they need to be. You always want to set your child up for success, but also yourself too as a parent. You know, it's overwhelming to not know how to help your child. As a mother, if I couldn't help my child, I feel helpless, and it's hard, and it puts you in a really hard place to not know how to help your child. And you know, as a mom of twins, there were parts of it, even as a doctor, I didn't know. I just assumed I'm a doctor. I know. But I'm like, no, I didn't. You know, I have the pleasure of knowing a good friend that's an ER doctor that had a baby with torticollis. She didn't know. ER surgeon. Like she can save your life in ways that I can't. So she is someone who is incredibly intelligent, very, very, if I am dying, save my life.
Yeah.
But there's just things that she knows that I don't know, and I know that she doesn't know. It's just, just being a doctor it wasn't enough to guide me through these steps. So I had to research and look into it and go learn in courses and get the education to better help my children, but also better help our patients. And that to me is the definition of a good provider, is what are you doing to treat that person to get them through whatever it is they're in any way we can, whatever it takes. We will, if I don't know the answer, I will find you somebody that does.
Wow,
so that's really our ultimate goal.
Just what you were saying, it's like when your child, when you can't console them or figure out what's going on, it's like, it's so easy to look in the mirror and be like, oh my word, I'm such a failure at this. Like this is, like you beat yourself up so much. So to hear it's very refreshing and helpful. Yeah.
That's and it's good. Not that you're failing. It's that you just weren't given the tools. Yeah. If you take a test in physics and you've never read a physics book, you're like, well, I'll wing it and see what happens. But you have to look at it as you just weren't given the tools to be better prepared. Because like I said, no one tells you. People just assume that somebody along the line is going to tell you what to do. And you have to do your research. You have to ask questions. You have to ask. But there is enough resources and information that people can access now to gain insight and gain information and in a positive way. It's trying to do it in a way where parents don't feel like, I did this wrong, and am I failing, and am I a bad parent? The answer is no. Yeah. If you're seeking the answers, you'll get there. And it's the other thing I have to tell people is be patient with the process, because you might do A, B, C, and it might all not work. So sometimes you have to be patient. Like, I did this and I did that. Well, you have to keep going.
Yeah.
If your kid isn't walking, you're not, well, that's the luck. You're going to do whatever you can to get that child to walk. And you're going to keep trying. You're going to keep looking. You're going to keep accessing the resources. Like, do we go to physical therapy? Do we go to OT? What's going on? Why aren't we walking? You're going to keep investigating and looking into the reasons of how you can help your child. So it's just one of those things. It's not that you're good or bad. It's just, you just lack the resources. You lack the tools and the information. So that's what we want to get, is all parents, information and resources and tips and things that you can do to help ease those growing pains as they are. And they're growing pains for kids and adults, for parents, especially first time. You don't know what to expect.
So you mentioned, we talked briefly, we grazed over breastfeeding. And I think that there's a lot of, obviously I've only been a parent for 18 months, so I don't know what you see, but I feel like I just hear so many people having breastfeeding issues. And a lot of people just aren't given the resources. We had, I think during our time I had a feeding therapist. We worked with multiple 2 or 3 lactation consultants, IBCLCs, the top of their field. And we still didn't have a successful breastfeeding journey in that he wasn't latching, and he ended up, I pumped for 10 months. And that's how he got my milk. So I just think about other mothers who are in the same position, or they're about to have a baby and they want to breastfeed. What do you think is going on? What can mothers do to improve that journey? What can mothers do to protect that bond or that relationship if they choose and they do want to breastfeed?
I think definitely you're the right track is getting with lactation and getting, at least getting some tools of how you can better feed. And then also to getting assessed for oral tie dysfunction, getting body work done, getting assessed for these things to help you better know. Because like I said, you may have to go to X amount of providers. You may have to do X amount of things until you get the answer. You're going to keep going until you find it. So I think getting with lactation is imperative. And there's plenty of places, I know there's a few areas around here that will offer free lactation clinics that you can go to. Most people, their insurance will cover it now too. So there's more resources for lactation and for providers who can help you along that. So access those resources. It's really more about being resourceful. There's resources and being resourceful. All the resources are out there, but you've got to be resourceful to find it. So getting those resources, getting those right providers, and doing exactly what you guys did. You guys didn't stop. You did lactation. You did lactation. You did this. You came and saw me. You came and saw, dentist for revision. You kept going until you got where you need to be. And for some parents, once they do release and they do body work, they nurse just fine, no issues. And some kids still struggle. There could be an issue with, a nipple size. There could be an issue, people assume that both breasts produce exactly the same, and it's not necessarily the case. Sometimes you may have one breast that produces more milk than the other. Everybody's different. I know I did with twins. So, it could be, and that's no fault. It just happens. Sometimes it's just the way it is. So if you are trying to nurse, keep going until you get there. And if you can't, then you can't. It's okay to bottle feed. They're still getting the nutrients. And if you can't nurse at all, there's nothing wrong with that either. There's nothing wrong with, if you tried and you've done all you can, it's not failure. I just want moms to know you're not failing. It's just, there's another way. You can do donor milk. We run a free donation bank in our clinic. Moms bring in excess milk. We find a mom who needs it. We don't charge. We just do it for free for our community. Wow. But if formula is all you can do, then that's all you can do. Find the best one that you can find out there. So there's no wrong way. It's just what works for you. And everybody's different. And that's okay. Regardless, you'll be okay, and so will your baby.
Wow. So good. I love that. I love the permission you give. Can we talk about, because I know you also work on mamas, so pregnant women, like the benefit of mamas getting body work and how that impacts pregnancy and baby and delivery and all that stuff.
Yes. So the technique we do with moms is called Webster. So the Webster technique is a technique specific to chiropractic that deals with misalignments of the sacrum and round ligaments. So what we do is we assess for where there's subluxations or tension, body tension in the hip, sacral, pelvis, and pubic bone area. And then the goal is to align those areas to create optimal fetal position for the baby. So ideally, we're trying to create the best two things. It's creating optimal fetal position by aligning hip, sacrum, and pelvis, but also to help decrease tension. Because, in pregnancy, there's a lot of sciatica, hip pain, round ligament pain, back pain. So we want to help decrease tension in the body, create more space for the baby, but also set up for labor delivery. So by aligning these structures, and we'll even align people in early stages of labor just to help accelerate the process. So it's more body work focusing on those areas related to the pelvis, just to open things up and get your body ready for that big moment.
The big moment. It's a big moment.
Big moment. It is. It's exciting. It's like you meet the love of your life on a blind date. It's amazing.
It is.
Right. Yes.
And we waited to find out the gender, so it was even more like Christmas morning
so
on
special.
It was so special. It was literally the best day. And I can't speak highly enough of getting body work done. I loved being pregnant. I actually saw a video the other day of someone on Instagram, and she was pregnant, and I was like, I'm kind of jealous of her. I don't know what came across my mind, but I was like, I want to be pregnant. I loved being pregnant. I felt amazing pregnant. Pregnancy was just, it was so good. And I do say, I will attribute that to getting a lot of body work done, getting myself taken care of, continuously moving my body. I think that that contributed to just a really, really beautiful pregnancy. So I can't speak highly enough about that. I kind of want to pivot a little bit, and I want to talk about children's health, because I know you see a lot of kids, and there's a lot of kiddos who are, I feel like, dealing with, I just see more and more asthma, eczema, allergies. And I don't know if you could just touch on some really important things that you tell mamas who are coming in with kids who are dealing with some of those things, who want their babies to be as healthy as possible. What are some things that you help them with, just taking care of themselves? Mama's taking care of themselves for sure, but taking care of their children as well, so that they can all be as healthy as possible.
And a big misconception we get is people say, do you only see babies? And I'm like, no, we see adults too. We treat the whole body. If there's a spine and a nervous system, there's tension, we're going to work on it. So we do family care. We do babies, kids, adults. We do, all kinds of different things. But one of the things we see in kids, if there's, those issues they present with, eczema, allergies, common ailments you see in kids, GI issues, is looking into two things: balancing the nervous system. The adjustments, the body work helps decrease your sympathetic and increase your parasympathetic. The parasympathetic part of your nervous system is that part of your nervous system that is the relax. That's the rest, digest. That's that beach vibe. I'm chill. Your body needs that. Kyro gives that to you. Cranials, massage therapy, things that just kind of relax you. Sympathetics are the hyperdrive. It's, the stress, go, go, go. So one of the things I love about chiropractic is balancing the nervous system. So we look to see where there are areas of hyperactivity to calm the nervous system, balance that, and then looking at the gut. What's going on with the gut? Where do we need to make maybe some nutritional changes? Do we need to remove inflammatory foods? So things like dairy, soy, gluten, dyes. Dyes are a big one too.
Oh, yeah.
So removing, that's a big one.
Yeah,
food dyes. Food
All
dyes
the
are the
food
big
dyes
ones.
in like cereals and candies
Yeah, I know.
and box processed foods.
It's everywhere. Yeah.
Yeah.
Everywhere. It's processed. Unfortunately, we live in a world of quick processed, foods, and what that contributes to your body. We're meant to eat natural, eating clean as you can, but it's harder when you got a picky eater. They tend to want to crave sugar and carbs. So keeping the diet as low inflammatory, AIP is a great place to start. It's anti-inflammatory. Diets are really helpful in keeping low acidity, lots of probiotic, heal the gut, because your gut will go, there's a brain-gut connection, but also gut to skin. So if you've got a high inflammatory diet, oftentimes you'll see skin outbreaks, you'll see things like eczema, you'll see, more inflammatory type issues that kids will have. So just keeping low acidic, nutritious diet. My kids have only ever known fruits, veggies, protein. They don't get dyes. They've never had fast food. They've never had any of those things. They've never had a Coke. They've never had it, but they're immaculately healthy. They never get sick. Their bodies are just, they're good. They're thriving.
Yeah.
And is that because, do your children receive care from you?
Yes. Oh yeah.
You know what I mean? So is that something you set up for children? Hey, we should do this once a month or every other month type deal.
Yeah. And my kids are, depending on, the season they're in, they play football, they do sports. They're very active. We're a very active family. And so if they're in season of sports, so if we're in, football season, they're going to need it a little bit more often. Maybe they go, maintenance for them is once a month, but they're boys, they roughhouse. So, if they're in sports season, it might be once a week or every 2 weeks. So it may be based on what they need in the season. There's no one set answer for every time in your life. You go through different seasons. So, depending on the season they're in, we adapt the frequency to what they need.
Yeah. And I think it's your kids know what you teach them, and what you expose them to. And, our son is like your kids, super healthy. He's never sick. He has so much energy. We're just how do you still have so much energy? It's amazing. It's really impressive. And I'm I will get comments from moms and stuff because his first foods were, pastured egg yolk, beef liver. He gets raw milk. He eats veggies and fruits and loves proteins and meats. And, it's that's what he knows. He's never had candy. He doesn't even, one time it was his birthday, his 1-year-old birthday. He cried at the cake. He didn't like the sugar. I was eating ice cream the other week and I tried to give him some just to see if he would like it. Didn't like the taste. His taste buds don't know sugar, so
they'll crave what you give them. They'll crave what you give them. Yeah.
So I think that
kids don't. There's something to that. By setting that pathway for success, they'll crave what you give them. If you give them healthy foods, my son was at a birthday party when he was 6, and they were eating cake and pizza, and there was an adult fruit tray, it was fruit and veggie tray. And I remember he walked up and he was eating the adult section, the carrots and the strawberries, and because he wouldn't touch, he didn't like the frosting, he didn't like how it tasted. So, and people were like, "Oh, you're a kid," and I'm like, "Nothing. It's just that's what he gets."
Yeah.
He's recognizing in the room with the food choices, he's recognizing the familiarity of what he gets, because children often don't do what you say, they do what you do.
Yes.
Right.
So they will mimic the behavior of the environment that they're in. Again, disclaimer, not a child psychologist, just so we're clear on that. But again, I have worked with many in the industry that have said, children will pick up the environment they're in. They'll do what you do. They don't do what you say. So if they see you having those healthy habits, they will pick that up in their own lives.
100%. Yeah.
So good.
We love it. We love this conversation. I think I have one final question for you.
Yeah, shoot.
So, for the mom who's listening, because I get so many moms who will message me on Instagram and they see how we live. And obviously we've lived this certain way, and health and wellness has been a top priority in our life for over a decade now. So it's just what we do. But
That's
for
great.
someone who's
I love it.
overwhelmed,
I
I know
love it.
it's just like
Love
it's
it.
our
I'm so proud of you guys.
Thank you.
Love it. You guys are doing great.
Look at us.
We're trying.
We're trying our best. Parenthood is
Say,
not
you
for the
guys
weak.
have the most adorable relationship. I have to say, I am so proud as a proud mama, doctor, patient. But I have to say, I'm so proud. The relationship you have, seeing the love and the connection. But a large part of that is that you guys are on the same page. And that's a big part of relationships, is having, you know, both parents come to a place of where they're in the same page on what their goals are. Yeah. So you guys having that congruency in your relationship, and then taking that into raising kids, it creates a healthy environment for them to thrive, because you've created a safe space. You have common goals, you have common interests, and you come together to live those dreams together. So seeing you guys, you know, thriving, you know, from where you started to where you are, and taking that information, sharing your experience. I just cannot tell you how thrilled I am to see that, and joy to see how well you two are doing. I mean, you are thriving and doing so well. You've got this podcast, you've got your social media, and you're sharing your story with the world in the most genuine, authentic way of seeing you two are just adorable together. And I'm so proud and loving this environment that you've created for yourself, but for your children. So I kudos to that hard work that you do, and you make it look so effortless too.
Well, I promise that we are not perfect behind the scenes. There's definitely days where we want to like go at each other's throats, but we are definitely, I think at the end of the day, it's what you said. We are on the same page, and we want to raise, you know, we don't take raising our son lightly.
No, absolutely not. Yeah.
Yeah.
It's a huge responsibility, and it's one that we're honored that we get to be involved in, you know, because we're like every day
It's about him.
it's about him. We're shaping him.
And
you
you
know?
make him first. You make him
Yeah.
first. And that's, you know, as a parent, that's what we do. We put our kids first. So
Yeah.
And that means a lot, Jen. I really appreciate that.
Yeah, because
Thank
we
you.
know you're with parents every
with a
single
lot of
day.
people, yes,
So you see parents every day. We appreciate that. We don't take that lightly. What would you say to a mama? My final question, what would you say to a mama who's overwhelmed? She's overwhelmed by all of it. The nutrition, the chiropractic, the craniosacral, the feeding therapy. Like, where should she start? Where should she start if she wants a healthy family, healthy babies? What's one thing she could do today or this week that would help take, you know, a step, even if it's just baby steps? What's something that she could do today?
that's a great question. And I do get that quite a bit, is where do I start? And I always tell people, start with what's in front of you. Take one step at a time. Deal with the biggest, if you have all these issues and all these things, deal with what's in front of you. Take one step at a time. So take the biggest issue that you're having and start with that. If it's feeding, start with feeding. If it's constipation, start with constipation. It's colic, deal with the colic. Deal with the biggest issue that's in front of you. So it's kind of like, you know, I look at my life, if, you know, when Tony Stark has all those, you know, Jarvis, and he's got all these things and he's just going like this. I look at my issues like that. I look at, I've got this and this and this and this and this. And I have these things too, but I've mastered the tools over the years of how to get better at managing stress and the things that come with me by going through, you know, I follow, you know, Tony Robbins has something called the 90-second rule. It's okay to get frustrated, anxious, stressed, and angry, but you have 90 seconds. So deal with it in 90 seconds. I have 90 seconds to get it out and then make my decision in a healthier, more beautiful place. So I deal with my issue in 90 seconds and then I go, boom, let's start going through solutions. So I go XYZ, what's the biggest issue? I take that and I put it in front of me. And I go, okay, 90 seconds, get it out of my system. I'm over it. And then I go, okay, what do we need to do? Now, obviously there are things that need more than 90 seconds. I'm a realist, I know. But deal with what's in front of you first. Take the biggest issue, start with that, and then take a stepping stone. Really, the hardest step is the first one. It's taking that first step to going, okay, this might not be the final answer, but it's a step in the right direction. So start with that and then see where you need to go. If you don't get an answer, move on to the next one. I go A, B, C, D. One of those three is going to get you right where you need to be, or at least on the right path. So don't take all of it at the same time. It's overwhelming neurologically to you and to your nervous system. Start with one thing and start with the biggest thing that's in front of you and then go from there.
So good. Yeah. I love it. Where can people find you? Where can they come to your corner of the internet?
We are Kyd Kyro. We are in Nashville. And yes, we see adults too. I know the names, just people throws people off. But we are in Franklin, Tennessee, actually. And our social media page is Kyd Kyro Nashville. We have a Instagram and a TikTok page, so you can get all this information, access it for free. So We are in Franklin, and we have got in there, the tag has got our phone number, our link, all of our information. So
Amazing.
anybody that needs us, we're here for. It may not be for everybody, but we are here for anybody.
I love that. I love that. And we will send people your way. We'll link your account in the
love
show
it.
notes.
Thank you.
You guys have such good content for mamas and parents who are raising babies and wanting to raise healthy babies in this crazy world. So you're doing the Lord's work out there.
Yes, you are.
I thank you.
Gosh.
My goal, my passion has always been to serve. So serving others in any way I can, healing, helping, restoration, that to me is what a doctor and a provider is meant to be.
You're doing it. We thank you so much. Thank you for
you.
being here.
I'm so grateful for you guys to have me on your show. I'm so honored to share this information. Thank you for allowing me to be in a safe space to share this. So I'm so excited. I'm so thrilled with what you're doing. I cannot wait to share this with our viewers and our audience as well.
You.
And I just keep going. I love what you're doing. Get this information out. More parents need this.
Yes,
so excited.
They do. I think our mission with this podcast really is to give people the information we wish we needed.
Yes.
Or what we wish we had. What
Love
we knew we needed and that we wish we had, because it truly put us on a completely different path. So thank you. Thank you.
It is, and keep growing. Keep looking, keep researching, keep adding, and keep growing. That's all you can do in life is forward momentum. Grow, grow, grow.
We agree. Well, thank you so much for being on Trust Issues Podcast. Thank you for listening. If you enjoyed this episode, leave an iTunes review, and we will see you next time.